Good morning, guys. Happy Thursday. I literally feel like a truck has hit me. I've been up since probably like 7 something, laying in the bed, uncomfortable. My back is hurting me so bad. Like, I don't know what the heck. I feel like I have like the flu. Like, my body is aching. I'm freezing and then I'm hot. So I'm not sure really what's going on. I don't even have the strength to make a shake. So I got a peach. That's gonna be breakfast. Michael's gonna take Easter to her hair appointment. I just can't. It's frustrating. When you've had back surgery and the smallest thing that you do flares your back up so bad. So I don't know if it was because we had to get that vinegar yesterday, 4 boxes, and then we got like a box of paper. So it took me and Michael to get it in the buggy and in the car. But my back was already hurting on one side because I felt like I had pulled something. So I don't know. So when I get finished with this, I'm gonna do some stretches. Probably take a muscle relaxer and lay back down. But I hope your day is better than mine. Cause like the sciatic pain is like a 25 right now. And I have issues with my pudendal nerve, which pretty much runs from inside like your butt up. Not sciatic pain, but like your butt. And it literally feels like I'm just sitting on a knife. So I got up at about 8 and got an extra pillow to lay on because I totally hate our mattress. You guys know that. And I just could not find a comfortable spot. So I just told him, I was like, excuse me, I was like, I don't feel good. And he was like, are you not gonna go walking? And I'm like, no, I'm not. I've done my 2 days this week. I plan to do 2 more days at practice. I think I'm doing good. And I'm thinking I've overdone it. So today is a rest day. And I feel like I'm gonna throw up. Like, I don't know what it is. My throat's feeling all weird, coffee, and I'm coughing. I don't know. I just pray it passes and I start to feel better by the middle of the day. We have an event that we're supposed to go to tonight at 6. If I feel like this by 2, I'm not going. Flat out, I'm not gonna go. So I will come back later. Hey guys, so trying to like let some light in. I got up, like I dozed off. Hold on. I dozed off and I just told you I just didn't feel good, and so I took my temperature because like when I woke up I had to go to the bathroom and I just felt so bad. So my temperature is 99.9. I know it's a low grade, but I feel like crap and I have no clue like why. I don't remember coming in contact with anybody knowingly that was sick, but I was tired when we went to church. But like I just was like, oh, I'm tired because we had went to Sam's Club and did some other stuff yesterday and I walked. But then when I came on last night, like my body felt like I had been hit by a truck. Like I was achy, my throat still hurts. So I just took 2 ibuprofen. I don't know what's wrong. So I got some Sprite. I don't have any orange juice, but like I just wanted to see if that would like settle my stomach. And I got some crackers. I know it's not on my diet, but who cares about a diet right now? So I don't know what's going on, or like where I caught a bug from. And I guess like, you know, when I had lupus, like I was always so cautious about just being around a whole bunch of people. Certain stores I would wear my mask, and now like, hey, I don't. It's just kind of, you know, scary, like not knowing. So like I told my husband, I'm trying to find my pulse ox. Hold. Sorry guys. Like I'm struggling like to breathe. It hurts. Like I don't know. Like my oxygen is good, but looks like when I get up, it's like a real struggle. So I'm gonna just rest. Like I told you guys earlier, like I felt like I was cold, I was hot, but then it was just like, well, sometimes somebody's just weird anyway. When it comes to like the bedroom could be one temperature, and then I go in the living room and I'm freezing. So I just thought like, oh, that's just what it is. So I had just honestly took a sip of water before I got up to go to the bathroom. So it's probably 100. Like, but I just really like, I was like, oh, let me just check it because I just feel like I'm freezing. So that means Michael will probably go in the guest room, and he'll quarantine me off. He'll come in the house, excuse me, I already know, and spray it all down with Lysol. So yeah, I'm not sure, but I'll come back. Alright guys, so my fever's broke for now. I had to get up after I came on the last clip. It was about like 12:40 something. I had text Michael. I was like, oh, can you pick me something up to eat? By that point, he was already like in the driveway. So I was going to go get something to eat, but then I was like extremely weak and dizzy. So I just made a egg and cheese sandwich like on wheat. I don't care about the diet, but I had to have something because I was shaking. And it just hurts when I breathe in. Because it's almost like my chest really hurts, but I've just noticed that it's with breathing, that it's hurting. So I'm about to go back to sleep. Michael had me slow left to go to practice. He's gonna go to the banquet for a couple, like an hour or less. It's at 6. That's pretty much all we're gonna do. All I'm gonna do. I'll probably have him pick up something for dinner. He's put ribs in the crock pot, but I know they're not gonna be done in time. So, yeah, I don't know what else me and Easter would eat. Like that, I have strength. I have fish, but like I don't have the energy to try to stand up and cook unless I feel better after this nap. Yeah, I'll come back and hopefully the fever stays gone because I took the last 2 ibuprofen. We don't have any Tylenol. Happy Friday, guys. So I did not come on today. When I got up, I felt a whole lot better. The fever started breaking about midnight. And the only issues that I'm having currently is that numbness in my shoulder, arm, face, like I did when I had to go in the hospital. And I still keep getting spells of like really dizzy and weak feeling. At one point last night, I thought I felt a little better. I still had a fever, but I was like, oh, I need to wash towels because we were running low. And I got the basket to the kitchen. Everything started spinning, and I just ran straight to the room and just crashed because I thought I literally was going to pass out. So, yeah. Today's been just, I've gotten some things accomplished, cleaned up most of the kitchen, but then I got really weak and then I laid down for like, I don't know, maybe 45 minutes. And I'm in bed. It's 9 something. I'm watching the Uber driver that killed those people on 2020. We have a track meet tomorrow. It's not our track meet. It's a high school track meet. And me and my husband want to go. We're going to help volunteer for a couple hours if I'm feeling up to it. But my face is so numb right now. I don't know if I slept on something wrong. I have no clue. But I took my blood pressure. It took literally 4 times for it to read my blood pressure. It kept saying that it was an error. So I'm just kind of like, I don't know what to think. I really haven't eaten that much today. I had a shake this morning and some fruit. I just don't really have a big appetite. I've been trying to like drink water, but you can probably still see it in my eyes a little bit, but I know it's dark. Hold on. Okay. So I have not rechecked my temperature since this morning, but like I started getting really cold again. I really don't know what caused the fever. To get that high, I had got as high as like 101.7 or 8, which is pretty high. Like for you not knowing why you have a fever, and then you wake up and fever's gone. You feel halfway back to yourself. But like I said, as the day went on, I just kind of got weaker and weaker. So I'm trying to decide if I'm going to go tomorrow, not go. Because I don't want to overdo it. Because we have practice tomorrow. But yeah, all of this is numb. Just for me moving, talking, it's numb. Like tingly feelings. So I don't want to go to the hospital. I'm not going to the hospital unless something gets drastically worse. I'm going to recheck my blood pressure. I'm about to do my medical marijuana and call it a night because I just don't have any more energy to do anything else. So I hope you guys had an awesome Friday, and I'll see you guys tomorrow. Lord's will. Be blessed. Hey guys, so we just left the track meet. Hello. We are tired, dog tired, and we're very, very hungry. We should have had a cheat meal. I guess I had pizza, but ham would be good for a salad. I know. Hey guys, so it's about, hold on, 8:43. Figured out what the heck is causing my fever. So I have a UTI or a kidney infection. I went through my mass box of meds and found some Cipro, like a 5-day supply. So I started it. I'm hoping it works because I have not had a fever with the kidney infection in a very long time. Like the last time I had fever, I had hydronephrosis. That was in like 2011, and in 2012 was when I went to kidney failure. When I had kidney failure, I had a lot of throwing up spells. Just, it was way different. So This, like, I feel nauseated, but not to the point like, hey, I'm gonna throw up everywhere. Had a couple times the day that I was, the night before the fever kicked in, I kind of felt really nauseated. But it started to like kind of subside. But today, by the time we got back to the track meet, it hit me like a ton of bricks. Because for some reason when nightfall hits is when I start to get like, just, I hadn't felt good. Like nightfall hits, I'm just like, oh, like I'm cold. It's like kicking in. And now it's like full-fledged burning when I urinate, pressure. I hope it hasn't gone too long because my back, you guys know, has been hurting. Almost a week now, my back has been hurting. I don't know if you see, well, I wash my hair, so what's up. But my eyes are red. I like I said, I got to do more research when it comes to fibromyalgia. Not sure if you're supposed to still get malar rash when you have fibromyalgia, but it's pretty pronounced. And my husband, he's the first one that noticed it when we were out. He was like, he's like, your butterfly rash is there. That's strange. And I was like, I don't know. And then when we got back to the other track meet, the lady said the same thing. She thought I was sunburned. And I was like, I don't know. Like, it is my fault. I have not just studied too much on fibromyalgia. My mom had that also, but I never like studied it as much as I did poured into the lupus part. So I've definitely got to pay attention to see what, I don't know. But the body's just kind of going haywire right now. So I did Brussels sprouts. Michael had made some ribs the other day, and I just had some baby back, so I did the Brussels sprouts, my normal, and I had a rib, 2 ribs, and that was dinner. And I worked on some track stuff because we had some payments, so I had to get stuff together for like deposit. So when we go tomorrow, I won't have all that inside of the cash box. But I told my husband, I was like, okay, I've done the deposit stuff. I've entered it. We have like a Google like spreadsheet that we put it in. I made folders. I put it on the ledger form. Like, we have so many different steps. But I told him, I was like, I don't have the strength to pull the uniforms, certain shirts in stock, so we can give to the parent tomorrow when she's there. So I'll have to try to do it eventually before we go to practice tomorrow. But I have to greet at church tomorrow. I was like, the devil is busy, y'all. Busy. And I'm like, I'm going to be greeting tomorrow. Hurting or not, I'm going to be greeting. So I've been drinking more and more water, trying to like, I've had, I don't even know how many ounces this is. I've had 2 today. This is my 3rd, but this, 2 before going back to the track meet, not knowing that, what it was. So I'm trying to like force myself right now. But y'all, I just don't feel good, and it's all over my face. So I just told my husband, I was like, I'm done. I'm going to go lay down because I have to be at church by 9. Just start greeting. I'm probably going to try to get there at 8:45 if at all possible, but we'll see. So I just wanted to pop on because I know I've only been on sporadically throughout the day. My husband, he said hi, but we were talking about some other stuff, so then I cut it off. Because the high school, they don't know how to run track meets. The middle school here doesn't know how to run track meets. And now they're finally asking us, can we help? But my thing is, we don't mind volunteering our time. But when you're saying bring our whole track club because we know what we're doing, you should have did that when you guys are scheduling the season, because we could have, it would have been easier for us not to plan certain things because we knew we're going to be helping this school run the meet. That's logical thinking, right? Logical thinking. But sorry, I'm looking over there. But yeah, that's the crap that we deal with in our county. God, my eyes are like super red. That is just so crazy. And I think that's why I've been kind of having the shortness of breath. And that ammonia smell is like very, very, very bad. And I don't care what anybody says, but if you Google ammonia, if you're breathing in ammonia smell, it's something with kidneys. So I'm going to see how I do tomorrow. If it gets worse tomorrow, I will take my happy butt to urgent care or hospital. Good morning, guys. Happy Sunday. It's 6 in the morning and I'm in a lot of pain. So I had to get up and make a peanut butter and jelly sandwich because I didn't feel like the whole diet, scrambled eggs, and all that noise. So I could take my antibiotics. Because last night I only got to take the one. And it's, it's every, I can't even talk, twice a day. So I needed to go ahead and get it in my system because the pain is pretty bad and intense. I laid in the bed for a while at 5 something. I read my devotional, prayed a little bit, and I was like, just get up because you're not going to get any rest. Just get up, eat something, take this medicine. So that's my plan. But I just want to pop on and say good morning, and I'll come back. Alright, guys. Look a little bit better. Getting ready to head to church. It's 8:27. It literally takes me almost a full 30 minutes to get. Sorry. Finally got my clip thing from Dollar Tree. Got my water. Got me a peach. I didn't do a shake because I had that peanut butter and jelly thing. So I've just got to figure out, because my next dose won't be due until, when I eat dinner. So I'll be okay then. So I got to figure out a different alternative for breakfast. Which I think will probably just do the scrambled eggs with spinach. I can get some ham and stuff like that. So I'm not eating the bread. But this morning, like I said, I was hurting. And I didn't want to be waking everybody up in the house because I'm trying to fix some eggs. So I got the easiest thing that I could do this morning. So, I'm still losing weight, so I'm happy about that. I lost 3 more pounds, so I'm like 210. The antibiotic, like I said, it was 6 something when I came on, so it's 8:30, so it's kicked in. Because at first I was like, Lord, I gotta make it to church. And now I feel like I'm starting to feel a little better. I still have burning, but I'm gonna try to drink as much as I can. So for the first 15 minutes of greeting, or 30 minutes, whatever, I can't really have my drinks right there. I'm gonna ask them, is there a way that I could I don't know, put it somewhere, because I really need to be sipping, and it's kind of hard to do. So when I get off of here, I'm gonna just start drinking as much as I can, and just let them know hey, I gotta go to the bathroom if I have to go, because I don't know, we have 2 entrances, so I don't know if I'm gonna be on the main entrance or not. I don't even know the person that I'm gonna be with. I'm still learning all the people at our church.
The name doesn't sound familiar, but that don't mean nothing. Because if you sit on one side all the time, you don't know the people that sit on the other side. So it's like 3 sections. But yeah, I'm gonna get off of here and drink this stuff, eat my peach. I'll come back after church. Michael didn't go. He's just tired and his neck was swollen. Nothing is helping at this point with his neck or his knee. With the knee, we're waiting on the VA to approve the injection that they want to do. It's like 3 series. So it's just kind of aggravating. And he's just like, I don't want to go back to the pain doctor with my neck because, like, when you're in a car accident, you have to still use your auto, and then you have like a 20% copay. And he's like, I don't want to pay 20%, of this for him to talk to me. I was like, you need to go because you're not better. And I don't know why the doctor, like, he did the measure dose pack, and Michael said it helped a little bit, but it's still not where it needs to be. And he did say it'll take almost 8 weeks to 12 weeks completely to notice a difference. But the swelling, it's like pretty bad. And I was like, you need to have that documented that it's not working. And he was supposed to have called him in when he did the prednisone, the gabapentin for the nerve pain, but he didn't. So I just assumed in our conversation he wanted him to do the Medrol dose pack first and then do the gabapentin if it didn't work. So I'm not really sure how the doctor wanted. I just don't know. So yeah, we're just trying to figure all this stuff out, like with this whole auto thing and whatever. But it's been a struggle because I feel so bad for him. And normally it was the roles were reversed. I was the one that didn't go to church because I didn't feel good, and now and I just think yesterday he probably just overdid it too much, and he just really needs that rest. So we've got to work out a better schedule on how we're going to do things for the weekend to like pace ourselves that we're both not overdoing it. I know we want to volunteer. We're trying to help, and like we're trying to get parents to understand, like, you've got to volunteer for these fundraisers. These are not our kids. Our kids are grown, pretty much. They're not in sports no more. So it's your responsibility to fulfill the commitment that we need you to, commit to. So, but it'll all work out. God always has a plan, and he always works it out. So let me get off of here. Alright guys, so I just left church. Got done greeting and I left. I'm headed to urgent care. The pain is getting kind of worse instead of better. And I know I've only taken 2 Cipro, but I need to make sure that that's going to actually cover the infection. Because it's pretty intense to the point of, like, my back is spasming, my head hurts. I just don't want it to get any worse than what it already is. So I will bring you guys along, I guess, when I get there. I called ahead and they said they don't really have anybody waiting, and which is good, because I guess because people are at church or whatever, hadn't woke up. So as soon as I get there, I will come back on. Hey,
Cheryl,
how are you?
I'm well, and yourself?
Getting a little bit better.
You've had better days, yes?
Yeah.
My name's Marshall. I'm the physician assistant on duty today. I'll be working up your case.
Okay.
How long have you had these symptoms?
I started Monday with back pain.
Okay.
But I've had 4 back surgeries, so I was just like, oh, maybe I just overdid it, because I started back like walking and stuff.
Okay.
So I was like, oh, I'll probably just pull something. But then by Thursday the whole day, I just spiked a fever out of nowhere, and it got to like 101.8. But I'm like, I don't know what it is. The only thing is my back hurting. and the burning sensation and pressure didn't start until yesterday. But I had 2 days with a fever, and it's normally, I've had UTIs a lot, and normally I get the pressure and I know.
Right.
I don't know why it took so long for me to know this time, and
Yeah,
and I was like, well, that fever, and I was like, it's probably my kidney bug.
Okay. So now you're having burning and urination as well?
Yeah, and spasms and pain in my back on both sides. And I have taken 2 Cipro. Took one last night and one this morning. I had a script for like a 5-day supply already. So. But then once I was like, I went to church, had to greet, and then I'm like sitting there, my back is like spasming even more. I was like, okay, quit putting it off and just go.
Yeah. We prefer you don't take the antibiotics like that. It boosts up our
testing
culture.
I know.
We'll run it. We're gonna see what this looks like.
Okay.
We'll run it. We'll treat you. You're allergic to erythromycin, but have you taken macrobid in the past?
Mhm.
Okay. Has it worked for you?
It's okay.
Okay.
Yeah. Between that Cipro and
Cipro's just tricky because it has some high-risk side effects, right? Large tendon rupture and kidney problems.
I've had kidney failure because I was on Xanaflex and Cipro at the same time, and no one caught that.
Okay.
I couldn't take both together.
Mm-hmm. Yeah. Okay. And when was your last back surgery?
2014.
Oh, so it's nothing you've had recently. Okay. All right. That's good. Stand up for me. I'm just going to turn you just a little bit. I just want to look at your skin back here and also your scar line.
Probably sweating.
Oh goodness, you have a scar here and here.
Yeah,
Is
I
it
had
from back surgery or that's something different?
I had Fusion L5S1, and then they put the spinal stimulator in and they had to take it out. So,
I got you. Okay. All right. Yeah, I don't see any redness or anything there.
Okay.
No. Turn this way. Is it here if I tap on you back here? And here as well? Yeah, I'm sorry. I'm over there. See.
I had lupus, but I don't have it anymore, so healed from it.
Wow.
Yeah, so I still have to tell people.
Yeah. How does it cure it?
Jesus.
Excellent.
That's all I can say, honestly. Like,
Yeah, I don't know that people
never been
don't
cured,
get cured from that.
Yeah, I got diagnosed in 2014, and as of December, 2 different doctors, they were like, it's not there anymore.
Okay. So raise your sweater up. Deep breath. And out. Deep breath. Good. To have you to wake up. Always does that. They have a pillow. They keep a pillow under here for some folks, and it knocks the roller up. Even had any nausea or vomiting?
No.
Okay. Do you often get nausea with your kidney infections?
When it gets really bad.
Okay. And this has been going on for a few days, so that's all tender?
Mm-hmm.
Here as well?
Yeah.
Your abdomen shouldn't be tender though, up there, right?
I think it stays that way.
You think it stays that way?
Yeah.
Okay. Tender in there?
When you do it, it kind of like bounces back.
Really? Okay. And tender in here. Okay. All right. We'll go ahead and look at your urine. We'll go from there. Okay. You're welcome. We will, like I said, we will run a culture just the same.
Yeah.
When was the last dose of the Cipro?
This morning
Okay.
at 6.
When did you take the first one? Yesterday?
Last night.
Okay.
Because we were at a track meet, and I was like volunteering, and as the burning started, I was like, oh crap.
Yeah.
So,
Okay. And those are the only 2 doses that you had? You don't have any more?
that was it.
Okay.
Well, I mean, I still have probably 4 more days left. It was
Okay.
like a 10-day prescription that I only had to do 5, so I still have.
And what was it for? Was it for a UTI?
I think it was for something else, from a surgery.
Oh, okay. Very good. Because a lot of times
I haven't had a UTI.
we'll just treat the urinary tract infections for 5 days,
Mm-hmm.
right? And if you have a long enough course of Cipro,
Yeah.
we'll see what this looks like. We'll run the culture. You may just stay on it since you've
Yeah.
already started
I
it.
just didn't know. I was like, I didn't want to go get azo because I'm like the spasms. Where I was like,
Yeah, and we can send you some Peridium. That will help with your spasms. But we'd probably just keep you on, let you just finish up the course of Cipro rather than give you a different prescription or a new one. And we'll just see where you're at.
okay,
We'll get the culture back and hopefully you'll know for sure, where you're at. Okay?
awesome, thank you.
All right, and obviously if the Cipro gives you any side effects, you let us know.
All right.
You're right.
273.2.
Booyah! Let's win all this.